Ms. Leger Fernandez, you are recognized for 5 minutes.
Thank you so much, Chairwoman Fox and Ranking Member Scott. It's great to see you again, Secretary Becerra, although I must admit it was a lot more fun when we were talking about rural health and there was mariachis, great art, and food trucks. But here we are.
Those food trucks aren't bad.
So for too long, and I know you've addressed it here earlier, the country has suffered from opioid epidemic. In 2022, nearly half of young adults aged 18 to 25 had either a mental illness or substance use disorder. I do not want to see another headline of a promising young person lost to overdose. That's why I'm introducing and I'm working with the committee around my Campus Prevention and Recovery Services for Students Act. Right now, colleges must operate programs to support students struggling with addiction. My bill makes sure those programs are evidence-based and the Department of Education coordinates with SAMHSA. Secretary Becerra, can you tell us why we need to focus on evidence-based programs to address addiction and how SAMHSA can be a key partner to the Department of Education and these schools?
Congressman, thank you for the work you do here, because what we're finding, and we probably have anecdotal evidence in our own homes, that oftentimes young people don't connect the facts with what they're doing, what they're seeing. So they think it may not be a problem if you have 4 or 5 drinks and that's not going to cause you any issues. Or they may not believe that there may be harm if you're taking particular drugs, even something like marijuana. And so it's important that we have data that shows what the true facts are so we can present that to our children so they have a better understanding of what might come before them.
Thank you. And working with SAMHSA will be key for us. At the CHC on the Road event, we had extensive discussion on the risk of closures of rural hospitals. Over 30% of all rural hospitals in the country are at risk of closing. In my district alone, Alta Vista Regional closed its labor and delivery unit. Portales, the Roosevelt General Hospital, reduced its staff hours. One bright spot, however, is HRSA's Delta Region Community Health Systems, which provides assistance to strengthen local healthcare systems across the Mississippi Delta region. But HRSA doesn't currently fund similar grants in any Western rural communities. Secretary Becerra, do you think that Western rural states like Nuevo Mexico would benefit from a similar program, and how can we work together to make that happen?
One of the things that the President Biden has done is given us opportunities and resources to focus on rural healthcare systems because, as you said, they are very stressed. But we could use more support to make that happen. And so you mentioned the Delta Region Community Health Systems Program, which has been very successful. I suspect there are other regions in the country similar in scope that could also benefit. So I'll be more than willing to work with you on something like that.
Okay, we'll look at that. I know it comes down to funding as well. And we need to remember, and people on this committee need to remember, when we want to support some of the positive programs that you've heard on both sides of the dais here, it takes resources. We both grew up in bilingual households and understand the importance of making sure our workforce is culturally and linguistically competent. In my district alone, 34% of households speak a non-English language at home. And we know immigrants get the job done, right? We are vital to our future success as a nation, including adding $7 trillion to the economy in the next 10 years, $7 trillion, and $1 trillion in government revenue, right? We're paying taxes. We are key. Immigrants are key to our success. So we must make sure that we can also serve them in our medical environments, take care of their health care because they so often take care of us. Can you share with us how HHS is expanding the number of bilingual physicians?
Congresswoman, thank you for the question. And as a son of immigrants, I can attest to what you just said. And what we are trying to do is make sure that as we expand the network of especially community health centers, that they are able to provide the services that are needed by the populations around them. And so more and more we're finding that to offer the linguistically and culturally competent care that's required, you really do need to bring in a workforce that can do that immediately. And so we're trying to support those efforts to try to bring in more physicians, more nurses, more healthcare providers who come from communities that are often disadvantaged. And we're also trying to make sure that we support services so that the communication between those communities and the healthcare providers are sufficient, because sometimes if the communication is not sufficient, the wrong information gets passed or insufficient information gets passed, and you could have terrible health outcomes. And so we know that there's a lot of work that we can do.
Thank you very much. Indeed, bilingualism is a superpower, and I want to thank you for that work. My time has expired, and I yield back, Madam Chair.
Thank you, Ms. Leger Fernandez. Mr. Bean, you're recognized for 5 minutes.
Thank you very much, Madam Chair. A very good afternoon, Mr. Secretary. Welcome back. I've got my very first question is something that unites